Hi, welcome to my presentation. I'm going to present on autistic spectrum disorder, ASD. First, I'm going to start. My name is Chibueze Ugwuanyi Christopher. I'm doing this presentation in fulfillment of an assignment in my pathophysiology class. So first, let's find out what ASD is. So autistic spectrum disorder and neurodevelopmental disorder characterized by impaired social interaction, communication, repetitive and stereotyped pattern of behavior, and uneven intellectual development, often with intellectual disability. So this condition is very complex and is very notable, especially among therapists that work in a school district. Most of the time, we see most of some of kids that have this condition. This condition can be very stressful to kids and the family as well, as it's a very challenging medical condition for kids because they had difficulty interacting with their friends. So they prefer to play by themselves instead of playing with their classmates because the way their system, the way their sensory processes information is different from the way typical developing kids' sensory information processing works. So the signs and symptoms of autistic spectrum disorder usually begin at early childhood. Some early indicators include speech development delay, loss of language or social skill, poor eye contact, excessive lining of toys or objects, and no smiling or social response. So these symptoms are very obvious when people are trying to diagnose this condition. Because most of the time we hear stories from families, they tell us stories like, oh, my kid was very active and interactive until he or she turns like one. And even at one, the baby was doing everything okay, but during transitioning from first year to second year, they started to notice like the child is losing language skill, like communication is no longer as effective as it usually used to be. And then the child begin to play in a particular pattern of way, either playing by themselves or lining up toys in a very particular way. So anytime the routine is changed, they touch room and there's always like one problem or the other. That is when they begin to understand that there is danger and they begin to seek help. So etiology, there is no consensus on the causes of autism at this point. Although there is strong indication that autism can be like genetic. So, but some people still argue that sometimes some might have something to do with medical treatment. So, but one popular study suggests that autism likely originated from secondary to error in gene causing abnormality in brain structure and function. So this is the link of genetics to autism, because anything that has to do with alter the function of the brain through the gene is considered to be genetic. And most of the time, people that have kids with autism, most of the time they have a higher chances of having another kid with autism. I have seen that so many times when someone have like maybe two or three kids that have autism. So Another thing we need to also know that others suggested a combination of genetic and environmental factors as the cause of autism. So some conditions that might environmental hazard that might exposure that might contribute to this is especially when a mother is pregnant or maybe newly when the baby was born, viral infections and drugs or alcohol use or carbon monoxide exposure are considered environmental risk factor for autism. So that means individuals are genetically at risk. Okay, okay, that means that genetically at risk individual may end up developing autism due to further exposure to environmental factors. Hmm. Shall I take the next? So anatomy is involved in this is brainstem, increase in hair circumferences and cerebellum. Cerebellum. Some studies suggest that cerebellum of kids that have a autistic spectrum disorder when they were scanned in the United Kingdom that they were like larger than the regular size of a typical developing child. All right. So incidence and rates and statistics of ASD. So according to Center for Disease Control, ASD affects approximately 1% of the world population, and 3.5 million Americans live with autism. The case of autism increased by 119.4% from the year 2000 to the year 2010, making it the fastest growing developmental disability in the whole world. Reason for the rising cases may be attributed to improved diagnostic techniques, because back in the days they diagnosed autism differently, and because of the update in diagnostic manual, other conditions were included as criteria to diagnose autism, thereby shooting the rate up. So more better diagnosis, increased rate. There are notable demographic differences also in terms of autism. So white kids are more likely to be diagnosed with autism compared to minority population like blacks or Hispanic, and boys are 5 times more likely to be diagnosed with autism compared to girls. So method of diagnosing this condition is basically examining the child's developmental history that, as mentioned above before, looking at the way, like just kind of probably using like sensory profile or using other diagnostic tools just to check if they had like retardation in their development and how they function, because those symptoms is basically what gives the diagnosis. So in terms of treatment, medication mentioned here are mostly used to treat the symptoms. Because the thing is, autism, I haven't seen, from my little experience, I haven't seen someone cured completely from autism, but I know that controlling the symptoms can be of help for people that are going through this condition. And in terms of non-pharmaceutical or pharmacological approach to treating autism, applied behavioral analysis, ABA, psychologists and occupational therapy treat various degrees of symptoms such as behavioral disturbances and occupational performance. So especially in the OT world, I worked in school district and we used a lot of sensory integration to not necessarily to cure autism, but to modulate the sensory of kids going through it in order for them to be able to function in the classroom with their mates. Sometimes, because of a lot of things is going on in their mind, they need some kind of sensory modulation or environmental modification in order for them to effectively uh, focus on their study in classroom. Especially, like classroom sometimes can be like over, like there will be like the light might be a kind of trigger to autistic meltdown, or the noise being made by the the colleagues of the individual that is going through this. Those things are things that may negatively affect the occupational performance of people with autism. So we worked with teachers to possibly modify classroom for these kids so that they will be able to function effectively. And also, we worked with parents, telling them what to do in terms of using activity to regulate function. Like like sometimes we have, because some of them are high function, some of them are moderate, some of them are like kind of severe. So, but it depends on the on how severe individual's case is. So we try to also get parents involved to make sure that they kind of carry over what we do in school when they go home, especially in terms of routine, and also using activity to regulate or to modulate their sensories, mm, which proved to be a little bit effective. But there is currently no cure for autism, as I said before, and the intervention is based on just symptoms reduction. Early detection and treatment may be able to help individuals going through this condition in integrating into their community and to live a productive life. All right, that's it for autism. Post question or comment below, and I'll do my possible best to address it. Thank you. Bye bye.